The physician should have the tools available to get a pretty strong indication of whether this is a food intolerance as opposed to a true food allergy. The presence of antibodies against the peanut, for example, which would also generate a positive skin prick test, is a pretty good sign that we're dealing with an allergy. Now, unlike milk or egg, peanut allergy does not tend to be outgrown. Only about 20% of people who develop a peanut allergy ever outgrow it in their life, and the reverse is roughly true for milk and egg. So we, in the clinical practice guidelines that were recently released, we do advocate routine testing in situations where there's an expectation the patient may outgrow the food or a period of time has passed with no unexpected reactions, but also we don't advocate doing it so frequently the patient and the family is constantly panicking.
Care to answer the same question, Dr. Sharma?
Yeah, so in our clinical practice, as the guidelines recommend, we do routinely, at some interval specific to the family, retest to see what exactly that peanut-specific IgE level has done, whether it's gone up, whether it's stayed the same, whether it's come down. And at some point, if it's come down enough, below a certain threshold where we think there's a good enough chance of passing a food challenge, we might then do an oral food challenge to, for example, peanut in our clinic.
A lot of people who have severe allergies often carry what's known as an EpiPen with them in case they accidentally eat the food they're allergic to. How common are these severe responses to food allergy?
So there is some difficulty in identifying the specific number of severe allergic reactions that occur each year, but we do know that every child who has a diagnosed food allergy due to IgE, which is the allergic antibody, is theoretically at risk for having one of these severe life-threatening reactions. The symptoms can include problems with hives, swelling, problems breathing, swelling of the throat, gastrointestinal symptoms like vomiting and diarrhea, and can even cause a drop in blood pressure. And so the medication that you mentioned, Kojo, that EpiPen or epinephrine, is an injectable medicine that can reverse these life-threatening symptoms. And it's absolutely important for all of our patients to carry this medicine with them at all times, because you can never predict when one of these life-threatening reactions may occur.
Dr. Fenton, how common is it for someone with a mild reaction to develop a more serious response?
I think one of the scariest aspects of food allergy is that a past history of mild responses is not necessarily an indicator that future responses will be equally mild. So that's what makes it very difficult to precisely determine who should or shouldn't carry epinephrine with them because of that uncertainty.
On to Tanya in Clarksburg, Maryland. Tanya, your turn.
Thank you so much for having me on. I really appreciate it. I'm just wondering what your panelists think about the idea of alternative medicine. I have a friend whose daughter had a severe peanut allergy reaction and was taken to the hospital, all of that, and ended up going to an allergist, testing positive, saying, you have to avoid peanuts, and ended up being treated by an alternative medicine doctor using homeopathic remedies and I believe acupuncture as well. And lo and behold, she is no longer allergic to peanuts. She's had her blood retested, and the allergist seemed rather amazed by it. I myself don't have food allergies, but I was able to treat a severe cat allergy in the same way. And I'm just wondering what your panelists think about the idea of alternative medicine for something like this. And I can take my comments off the air.
Okay, here's Dr. Sharma.
So this is a great question, and one that I think we need to study more. There has been some interest in the use of, for example, Chinese herbal medicine in the treatment of food allergy, and that's currently being studied by the group up at Mount Sinai in New York. But the use of acupuncture, homeopathic medicine, hasn't been extensively studied for the treatment of food allergies, so we don't have a great handle on its effectiveness, or if it is effective, how it actually works. So what I usually recommend to patients is that if they're interested in pursuing one of these alternative medicine therapies, to only engage in things which have the minimum
first that at the current time there are no FDA-approved treatments for food allergy. The epinephrine we discussed earlier is for use in managing severe reactions, and other medications such as antihistamines serve the same purpose, to manage the reactions. The NIH is funding a number of clinical trials that are exploring what we think is a potentially powerful new therapy, which is generally known as immunotherapy. The idea of giving that allergen in some form to the patient in a graded dose over a particular period of time, and by any one of a number of different routes, orally, under the tongue, on the skin, or even through injection, and then reprogramming the immune system to tolerate that allergen, so that after a particular time of treatment, their immune system no longer sees it in a sense as a foreign invader, but knows to tolerate it.
Gotta take a short break. When we come back, we will continue this Food Wednesday conversation on food allergies. If you're calling and the lines are busy, then go to our website, ask a question there. It's kojoshow.org, or you can send us a tweet at Kojo Show. Shoot an email to kojo@wanu.org. I'm Kojo Nam.
Support for WAMU 88.5 comes from Whitetail Resort. Whitetail is now open, offering fresh groomed snow for skiing, snowboarding, and snow tubing. Directions, conditions, and live webcams and more on skiwhitetail.com. And from Hermitage in Northern Virginia, serving area seniors for more than 50 years as a fully accredited continuing care retirement community with independent and assisted living apartments. 703-797-3800.
Some seniors can make a tax-free contribution to WAMU 88.5 of up to $100,000. If you're over 71 and a half and have a traditional or Roth individual retirement account, you can help support the programs you love every day. There's a 30-day grace period until the end of January for savings in 2010. For more information, contact your financial advisor or call us at 202-885-8904, and thank you.
Partly cloudy skies tonight with lows in the mid-20s. Tomorrow, a cloudy afternoon with highs in the upper 30s. 52 degrees in northwest Washington. Now back to the Kojo Namdi Show.
It's a Food Wednesday conversation, but we're discussing food allergies with Dr. Matthew Fenton, Chief of the Asthma, Allergy, and Inflammation Branch at the National Institute of Allergy and Infectious Diseases. He's one of the primary authors of new clinical guidelines for doctors who treat patients with food allergies. And Dr. Hemant Sharma, Director of the Food Allergy Program at Children's National Medical Center. We got this email from Lawrence. I decided to go to it so I could get the pronunciation issues out of the way. Lawrence says, I was recently diagnosed with eosinophilic esophagitis, which is an inflammation of the esophagus that is believed to be related to food allergy. I'm going to get tested in 2 weeks for various food allergies. I was under the impression that allergists are getting more familiar with this problem and wanted to know what the guests say about it. First, you pronounce it 5 times. Dr. Sharma, go ahead, please.
That was an excellent job pronouncing the Kojo. And we were just joking, Dr. Fenton and I, that we abbreviate this condition EE so that we don't have to pronounce it every single time.
Thank you.
But there are a number of more patients being diagnosed with this inflammation in the esophagus with a particular kind of white blood cell that's the allergic white blood cell called the eosinophil. And there is thought and evidence that this inflammation is triggered, at least in part, by foods. And so it's a form of food allergy that is more delayed in its presentation. So you would not have esophageal symptoms immediately after eating the food, but the food over time with chronic ingestion would lead to inflammation of the esophagus, which can cause symptoms including abdominal pain, vomiting, problems with swallowing, and in some cases even food getting stuck in the esophagus. So we're learning more and more about this condition, and we do, and the guidelines do support an assessment for food allergen triggers of this esophagitis in patients who present. And that assessment is done often with a combination of testing modalities using some blood tests as well as skin tests.
Dr. Fenton, is there any understanding of why a person might develop an allergy to a food after years of eating it? Why does the body all of a sudden seem to trigger this response?
Well, it's a great question, Kojo, and Dr. Sharma mentioned at the beginning of the hour that the hygiene hypothesis is one of those concepts that's been put forward for why we see an increasing number of allergies. But in addition to whether we are exposed to a cleaner versus a less clean environment in our society, there are a number of factors that also have a very strong role in determining the risk to food allergy. Family history and genetics is one. Many of these diseases often track in families. Early exposures to pathogens, respiratory viruses within the first year or two of life are critical. There's some thought that even the diet of the mother while she's pregnant can be very important in that we see newborn babies with evidence of antibodies against food in their bloodstream. But also, it turns out that one of the factors that may play an important role are the bacteria that live within our own gastrointestinal tract. These bacteria can change, they can influence allergic responses, they can even be affected by diet. So as people move throughout life to new environments, move from one city to the next or one country to the next, they're exposed to new allergens, their new foods, the microbes in their gut change very quickly. Even bringing a pet into the household is enough to change the microbes that live in your gut. All of these can play a role in triggering an allergy even in adults.
And I guess Jonas in Davidsonville, Maryland wants to talk about the reverse of that. Jonas, you're on the air. Go ahead.
Hi. I am 14, and for a long time I've had a lot of allergies. Recently I outgrew peanuts and soy, but I've got a wheat and gluten allergy, which I carry an EpiPen for because I go into anaphylactic shock if I ingest it. And I was wondering what the chances are that I'd eventually outgrow it, because it's really, really, really annoying.
Dr. Sharma, I know I've seen to outgrow some intolerances, but is it possible to outgrow allergies, so to speak?
Great question. And first of all, I'm glad that you outgrew the peanut and the soy allergies. It is absolutely possible to outgrow food allergies. The likelihood of outgrowing a food allergy depends somewhat on the specific food. And so, as Dr. Fenton alluded to before, peanut allergy is one of the harder food allergies to outgrow. Maybe only about 20% of people with the peanut allergy will outgrow it over time. Whereas some other foods like milk, egg, soy, and even wheat, the numbers are much more favorable. Up to 80, maybe even 90% of people who have those allergies will outgrow them. We used to think that if you were going to outgrow your allergy, you would outgrow it in early childhood. There's some recent data that suggests that you can even outgrow your food allergies into later adolescence or early adulthood. The way to find that out, again, is to follow the test results, specifically the blood test result, to see what the level is doing over time. And if it is trending downward, that may be an indication that the food allergy is being outgrown.
Jonas, does that answer your question?
Yeah, wow. That's great news. Thanks so much.
Jonas, thank you very much for your call. A number of calls and emails about peanut allergies. I'll start with one from Terry, who says, my daughter has a severe peanut allergy, and my husband has been working with Dr. Robert Wood at Johns Hopkins to further research in the sublingual immunotherapy area, basically giving the affected person a tiny amount of, say, peanut powder, then working up to a whole peanut. Because drug companies will not make money off of this process, we're looking at a delivery mechanism rather than a drug. It is difficult to secure funding for this research. Can you discuss your thoughts on this future potential cure and thoughts on funding, Matthew Fenton?
Well, it's certainly a question that I have to deal with every day, and the NIH is the major funding source for food allergy research in this country is very dedicated to providing research funding to develop new treatments. So the caller is referring to a type of immunotherapy similar to what I mentioned earlier, in that you are giving a small amount of this material, building it up over time, and developing immune tolerance to this. These are the types of studies as controlled clinical trials that we support through NIH funding. We have a large number of similar trials, including trials that are underway by Dr. Wood and others to look at this type of treatment for peanut as well as milk and egg and other allergies. So I think we're putting a lot of money into this. Since 2003, the amount of funding by the NIH for food allergy research has gone up about 16-fold. So there's been a large interest in this from the NIH, from Congress, and we're doing our best to see